We're joined in this portion of our program on the Sunday Magazine. I'm Bob Salter. We move into a discussion on our program with Nicole Zeitzer Johnson. She is co-founder of the FOXG1 Research Foundation. Now, some of you are saying, FOXG1 Research Foundation, what's that all about? You're going to find out about the foundation. There's an important website that we will give you as well for the foundation in the course of our discussion. Nicole, in her background, is a former TV producer and music entrepreneur, and she is joining us by phone to share some of this story with us. It's nice to have you join us on our program. Good morning.
Hi, Bob. Thank you so much for having me.
In beginning our discussion, I guess we should go through and talk about exactly what that term FOXG1 refers to, and in a way you can sort of branch us into talking about how the foundation came to be, too.
Sure, yeah. So FOXG1 syndrome is a condition caused by a mutation in the FOXG1 gene. Now, the FOXG1 gene is one of the first and most critical genes in brain development. So when there's a mutation to the FOXG1 gene, it causes FOXG1 syndrome, and it's a rare and it's a very severe neurological genetic condition that causes children with FOXG1 syndrome. Some of the characteristics of children with FOXG1 syndrome, such as my daughter, Josie, is epilepsy. Josie is fed with a feeding tube. She basically can't take care of her basic needs. She's 6.5 years old. She can't sit up without falling over, or anything above that. So she can't crawl. She can't walk. She can't talk. So it's a very debilitating and devastating genetic disorder.
And when you talk about the incidence of this, getting that diagnosis, what was that like?
Oh, gosh. So, well, because it's such a rare disorder, it took us 2 years to find a diagnosis for Josie. So, after she was 4 months old when I first realized, hey, she should be tracking with her eyes like my son did. And by 6 months, she wasn't sitting up. So we started, the round of testing then, and we were doing every test under the sun, MRIs, full genetic testing, everything, and everything kept coming back normal, 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 normal. And month by month, Josie was not developing. And nobody can tell me why my daughter wasn't developing. And she started having something called infantile spasms. And it was just, it was just really unbelievable. We were traveling the world to try to find out what she had. So finally, I found out about something called whole exome sequencing, which at the time was a new test in genetics, whereas instead of a geneticist testing for how the child presents based on conditions they already know about, with whole exome sequencing, they test every single gene in the genome. So if you are the only person in the world with a certain mutation to a gene, you could find out. And we found out when Josie was 2 years old, and it was, the most devastating experience of my life. I remember the walls of the geneticist's office closing in on me when he said Josie has something called FOXG1 syndrome. I really think he did a Google search right before we walked in because there wasn't much known. And he said, Josie will never talk. She will never walk. She will not develop. He gave me the most dismal prognosis a parent can get when I asked the dreaded question of, well, so what is the lifespan? He looked at me and shrugged and said, teens at best. And I will tell you now that fast forward, that I've started my own research foundation and I've learned so much more about this condition. That does not have to be the case. In the time that I've known about FOXG1, there have been 9 FOXG1 children who have passed away. It is, we do have, the clock is ticking for our research. We really do have to get there to help save Josie, but I am hopeful that we can.
Mm. When you get that diagnosis and, you're dealing with that news, are there moments where you simply say, why me? Why us? Why her?
Oh, of course. At the beginning, yeah, I was kind of living outside of myself at the beginning of this, especially when the seizures started. There's almost no words to explain what it's like when it's like this monster takes over your child. Then I get this diagnosis, and my life was turned upside down. So of course I, said, why us? Why Josie? Why my little girl? And then the blame game sets in. What did I do? What did I do? And it wasn't too long after, though, that I said, hey, I have a choice. I could just wallow in my sorrow, and I could say, why me? And I could, disappear into this, or I could say, why me? And realize that I've been given a gift. I've been given a purpose. Josie is such an incredible girl who just, changes the life of everyone around her, and I know that. She's got this joy inside of her. She smiles, she laughs. So I started to say, okay, so what's being done about this? I was a producer at CNN for a very long time. I know, how to get right down to the heart of the story. I believe that life sets you up for what you need. So I got together with two other FOXG1 moms, and we looked into every scientist out there who has ever done any research into the FOXG1 gene. And we learned that there are scientists out there not only who have been studying it, but who want to study it because, and here's the greatest thing that I've learned, is while FoxG1 syndrome is a very, very rare disorder, when Josie was diagnosed, she was the 60th person in the world with it. Today, right now, there's about 460. It's rare, but FOXG1 is one of the first genes in human brain development, and it's called a transcription, so a transcoder. So it turns on other genes. So scientists are very eager to study FOXG1 and do the research because they believe that it holds the link to many other brain disorders, that there is FOXG1 expression found or missing in other disorders such as autism. We currently have a research project at Yale studying the links, also Alzheimer's, schizophrenia, brain cancer, and more. So, when I got this diagnosis and I felt like, gosh, it's so small, who's going to care? That has all changed. Our research is so critically important to brain disorders at large.
Mm. And when we're talking about the incidence of FOXG1, any area geographically where this stands out, or is this everywhere?
It's everywhere. And, that's a great question because, like I said at the beginning, why? Why did this happen? What causes it? And, of course, I'm thinking, what did I do while I was pregnant? How did I cause this? And the truth is, FOXG1 is a spontaneous mutation to the gene. It's called de novo, of new in most cases. So we are not carriers. That just really underscores the delicate process of human development, of DNA being written. The FOXG1 gene, in certain cases, it's a misspelling of the gene, and it causes this mutation, and it could happen to anyone, anywhere. And the truth is, FOXG1 syndrome has been happening since the beginning of time. For many, many years, there wasn't a name for it. People were calling it other things, perhaps cerebral palsy or early on mental retardation. There must have been so many children from the beginning of time with FOXG1 syndrome and being born all the time. But now there is awareness around it. It was originally called brain factor 1 because it is one of the first genes in brain development. Then it was given the name congenital Rett syndrome because it seemed to present very similar to Rett syndrome, but it's a different gene. It's not the MECP gene, it's the FOXG1 gene, and the NIH has given it its own name, FOXG1 syndrome. And we are really on the move with research around it and how we could move forward with gene therapies to fix it.
Mm. Now, when you're talking about the incidence of this, um, where do you turn or where did you turn, I guess, for treatment, for an approach to this?
Right. So, being in the New York area, I'm very lucky to be somewhere where some of the most, brilliant doctors in the world are. It was I went through several neurologists, and it was finding a neurologist, Dr. Davinsky at NYU Epilepsy Center, which really changed the course for us. So Josie was having horrific grand mal seizures. When they first started, she was turning blue. She was stiff. I didn't have the rescue meds at the time. I was running in so many different ambulances, and we had so many different video EEGs and got her on different rounds of anti-epilepsy medicine. And it was, when I finally went to Dr. Davinsky at NYU is when things really started to settle down and level off. And I found him because I was following a study he was doing on the effects of CBD oil on seizures. And fast forward, he is the doctor who led the study to bring Epidiolex to market. So the FDA recently approved the first pharmaceutical version of CBD oil. So at the time, he couldn't put Josie on his study because she didn't have the rare disease that it was following. But we did start CBD oil, and that was really what I call the icing on the cake with all her other anti-seizure medicines to control them. So that was, the biggest turning point was finding Dr. Davinsky. Of course, we have a whole bunch of different doctors that Josie sees. She has a feeding tube, so she sees doctors basically for every area of her body, but neurology is number one.
Mm. Amazing, simply amazing. Now, some people also will ask the question, they hear CBD oil, and there's a lot of interest in CBD. There's a lot of interest, period, in discussions about anything involving cannabis these days, but a lot of interest with CBD oil. Some people will raise the question, though, wait a minute, you're a mom, is this safe to be giving to your child?
Oh, absolutely. Yeah, I mean, CBD is everywhere now. I mean, you can find it in snacks in the store, in creams for muscle pain. But as far as it goes for epilepsy, which is a severe condition, yes, no, I was never worried about whether it was safe. I did my homework. I mean, CBD is a compound in the cannabis plant that is not psychoactive. It comes from the hemp. It attaches to receptors, or it inhibits the body's own natural cannabinoid to do certain things, and that's what the study was about. So, if you're using a pure CBD oil, I believe there's absolutely nothing to worry about. When you compare CBD oil to the heavy-duty pharmaceuticals that are, Josie is on to control her seizures, I mean, this is so benign, so yes, I absolutely believe CBD is safe. And not only that, it's been like I said, the icing on the cake that's given us our life back. Josie, every time she would have a seizure, they say it's like the brain running a full marathon. So just when she started to improve cognitively, wham, she would be set back, 100 steps with the seizure. So when we started CBD oil and it really started to control her seizures, we noticed such improvement cognitively. She's so much more connected, and that's really only improved over time. And I should say that, when we started CBD oil, This was after going through months and months and months of trying to get on the right medicinal cocktail of the pharmaceuticals that are available, heavy-duty pharmaceuticals. And, we got to a point where, at best, Josie was still having 4 seizures a week. They were more mild. They were... we had rescue meds, but there were still 4 a week. So that wasn't something any parent wants to accept, but that's where we were. When we started CBD oil, we went our first week without Josie having a seizure. I couldn't believe it. Then we went a month. Then we went 2 months. And then we went a year. So Josie went a year seizure-free once we started the CBD oil. Then she had breakthrough seizures. She grew. So this is something I've learned I really have to stay on top of. I've always got to get her blood work done. She's still on all the other meds, and that's not something I've been able to wean her off of. But this is what's really given us the greatest relief.
We're talking on our program on the Sunday Magazine with our guest, Nicole Zeitzer Johnson. She is co-founder of the FOXG1 Research Foundation. What's the website for the foundation?
Thank you. So it's FOXG1Research.org. And we also have a Facebook page, FOXG1 Research. So just please make sure to include the word research. That will come to our foundation, and we are leading the research to find a cure for FOXG1 syndrome.
Now, part of the reason for our discussion today is to promote awareness of the syndrome and awareness of the work of the foundation. The other aspect of this is there's an event that's taking place at the end of this month that I wanted you to be able to talk about because it actually happens a week from today on the 26th. Would you tell us about it?
Sure. Thanks so much. Yeah, so a very good lifelong friend named Chris Pepe, who is a rock star. He records his own music. He's very influenced by Led Zeppelin. My husband and I have known him for many, many years, and he decided he wants to help. He sees what I'm doing with Josie. He knows how critical fundraising is for us to reach our goal, which is clinical trials of gene therapy. So Chris is having his band play at the Landmark Theater in Port Washington on August 26th at 6:30 p.m. It will be Chris Pepe's original music, and there will be 2 other bands as well. And it's all to raise money and awareness for FOXG1 research and help us reach our goal.
And when and where the event, and how can people get information on tickets?
Sure. So it's on August 26th at 6:30 p.m. at the Landmark Theater in Port Washington. If you go to our FOXG1 Research Facebook page, so that's FOXG1 Research, I've added all the event information there. You could get tickets by going to a website called brownpapertickets.com. You can call 1-800-838-3006 to purchase tickets. And again, if you go to FOXG1 Research, our Facebook page, you can follow our progress for FOXG1 syndrome and finding a cure. And you could find all the information for this event that is on Sunday, the 26th of August, with Chris Pepe.
Now, what is fundraising like?
So that's the toughest part, So you would think, finding the world's best scientists to do the research. And, of course, we have the scientists in place. The research itself is not easy, but we have a path to a cure. We have how to get from point A to point Z. We know that we're going to get to gene therapy clinical trials. We have all that in place. What we need is the money to fund the scientists, to pay for the clinical trials. That's the hardest part. So, fundraising is the hardest part. We really need to find philanthropists who are looking to put their money into something that will make a huge difference in the blueprint of human life. And we have to have events. Every dollar counts. not only to help us find a cure for FOXG1, but like I said, our research is so critical to so many other disorders like autism potentially and Alzheimer's, brain cancer. And I've been doing the rounds and speaking to so many different biotech CEOs, when we really to figure out what our path is moving forward. And I've really been inspired to learn that everything we're doing is so critical to science and human life. So we know that all of the money we're raising is going to potential gene therapies for FOXG1, and that could lead to so much that we don't even know about yet. Everyone working in science is improving the future. So, I'm very inspired by our work and what we're doing, and fundraising is really the key. It's really the critical part. So, when Pepe came to me and said, I want to do this concert for you, it's so amazing and it's so important, and I hope to, continue to do things like this as much as I can.
Mm-hmm. What has been community support? What's that been like for you?
It's been really great. I've had support in so many different ways. People sharing our Facebook page, people, doing different news interviews, people really just reaching out how I've really helped to give them perspective on when anything happens in life, how you can make lemonade, how you can look at something and instead of wallowing in your sorrow, you could really, take it and do something great with it. So my community in Port Washington has been amazing. My friends and family have been incredible. The other FOXG1 parents, especially my two partners who I've launched FOXG1 Research with, have been amazing, and we've seen the support worldwide. We have a worldwide fundraising team of FOXG1 parents for the FOXG1 Research Foundation. We've got these two FOXG1 dads in France who have raised an incredible amount of money for us in our first year, and really thanks to them we were able to kick off. We have 6 research projects underway. So when I speak to these biotech CEOs, they almost can't believe how much we've accomplished in such a short amount of time. We have mouse models. We are funding, right now we're raising money for a stem cell research project that's next. And it's so really the support is critical, and it's been really amazing.
Interesting discussion. One of the things that I was thinking about too is this idea of what it really will take to, I guess, take the foundation to the next level. Is it as simple as fundraising?
It is. Yeah, it really is money. We have, if you go to our website, FOXG1Research.org, and you find the navigation to Path to a Cure, we have a path to a cure. We are in phase 1 of research right now, and this is our mouse models and our stem cell study. Right now we're gathering all the assets that we need. So that's all the answers that we need if we see a reversal of symptoms in the mice, and then in the stem cell studies. So this is critical right now, and we do need about $3 more million to get through phase 1 of research. And then next we vet the different gene therapies. So we try different gene therapies, whether it's RNA, DNA, different types of gene therapies to see what is effective. And once we have these answers, the goal is to then, get to clinical trials and hopefully get biotech investment at that point. So really to get us, we really are looking for anchor donors to help get us through very specific research projects that will then get us to the clinical trials that will, hopefully cure our children. Curing is not necessarily the right word. the reality is that we are looking for therapies to help reverse symptoms. You know, that's actually being correct about it. So it's getting to clinical trials, and it takes money to get there. And we have incredible scientists in place. And what's really interesting, which could be a show in its own, is that our lead scientists that we have an incredible scientific advisory board that was very critical to our foundation. And actually, Dr. Davinsky is leading our scientific advisory board. So that has opened many doors for us. So when we get these proposals from scientists, our scientific advisory board helps us vet our priority, who we should fund. And the scientists, our lead scientists who got, the most glowing reviews from our scientific advisory board are the Lees, Dr. J and Sue Lee. There was recently an article about them in the New York Times. Not only are they brilliant scientists that had incredible proposals for studying FOXG1, Dr. Sue Lee has been studying FOXG1 for 10 years, and later, a few years into studying it, she had a child with FOXG1 Syndrome. It's really an incredible, amazing story. So not only do we have a scientist who is so brilliant, there is a passion there to find a cure for this disease that, is like none other. She's a FOXG1 mom. So it's really, we have that story on our website, FOXG1Research.org, under the news page, and it's really a must-read.
And there's no passion like a FOXG1 mom's, obviously, too.
That's true.
When you look and think to the future, are you hopeful?
I am hopeful. I'm hopeful, and I'm inspired, and, I'm sticking to it. I always say this will be Josie's story to tell one day. I believe that, and I know there is a revolution happening right now in gene therapy, in science, in biotech. There is so much exciting news out there every day. So I know that if I just keep my head down and I continue with this work, suddenly I, like we talked about, I was a news producer, I was a music entrepreneur, and now I am immersed in the world of science. And this is what I'm doing, and I'm going to continue at it with my incredible partners and team, and we're going to get to clinical trials. Of course, I'm well aware that Josie is now 6.5 years old, and the clock is ticking. So that is, my partner's children are younger. They're 2. So, I'm praying that all the work that we do can benefit Josie. First and foremost, I am a mom desperate to save her daughter's life and to give her, the abilities that she deserves and the life that she deserves. So, yes, I am doing this for my child, but I do know that our work can help, thousands and millions of other children and really change FOXG1 syndrome moving forward. So I'm incredibly hopeful and, of course, nervous as Josie gets older, that, she will benefit from all my work. But I'm going to say that she will, and I'm going to stay positive, and I'm going to keep on going and, hopefully save millions of lives while I'm here.
Well, let's hope that you can indeed do exactly what you just said and that things do move forward in a positive fashion. Sounds like you've certainly got the ball rolling in a lot of different areas. Nicole Zeitzer Johnson, our guest in this portion of our program on the Sunday Magazine. She's co-founder of the FOXG1 Research Foundation. 2 things I'd like you to do. One, tell us again about the event on the 26th, and please give the website for the foundation.
Sure, thanks. Yeah, so if you're in the New York area, on Sunday, August 26th at 6:30 p.m. to 10 p.m., Chris Pepe in concert. He is having this concert to raise money for FOXG1 Research. Please join us. There's going to be a silent auction and a live auction and Chris Pepe's music, which sounds a lot like Led Zeppelin, and it'll be a great time. And you can find out so much more information about the foundation that I started that I co-founded, FOXG1Research.org. So that's one word, FOXG1Research.org. And please also like our Facebook page, FOXG1 Research. And anyone could contact me at any time if there's anything you want to talk about. My email is Nicole@FOXG1Research.org.
Okay. And that's FoxG1, and that's the numeral 1, research. That's all as one word, .org.
Yep.
Nicole, thank you very much for joining us on our program.
Thank you so much, Bob.